Can't really see myself because of that. Hey everybody, what is up? Happy Tuesday. I am so excited to be making this live video with Dr. Karen Dantin. But before we get into it too much, I am going to try to get some of y'all invited on here. So be patient with me really quick because we have exciting things we're going to be talking about, right?
Always.
Yeah.
Always exciting things.
Yeah, so it's a lovely day. Please share our video. Hey Danielle. Hey Shelby. What's up, y'all? So I am here today with Dr. Karen Dantin, and you probably have heard me talk about how amazing I think she is. But we are here to talk specifically about our Fuel You retreat that is going to be happening in July, the end of July, the 27th through the 29th. Hey Lauren, thanks for jumping on all the way from Colorado. So obviously we are here at Dr. Dantin's office and things are busy, so we're going to make it really quick. But we want to talk to you a little bit about the event and just kind of introduce her as our keynote speaker. So we're super excited because she's extremely knowledgeable, and I am going to let her tell you a little bit about her philosophy for practicing medicine and how she treats her patients.
Well, basically, I always tell patients or people that I consider myself a holistic doctor, and that means two things. It means when patients come in with their 8.5 by 11, both sides typed, whole lists, my goal is always to try to get to the whole list in the appointment, because sometimes the most important thing is the last thing on the back of the page. Like the guy I had that says, you know, doc, just I'm trying to put my hand on the doorknob. I had this pain in my chest. It's going down my left arm, and my dad died at my age of a heart attack. Do you think that's important? So it's like, okay, let's sit back down and talk about things. So unlike a lot of doctors where it's one patient, one problem, one appointment, I try to get as much information for the patient because, for one thing, that's how I figure out what's going on. And second thing is, I can get to what's really bothering the patient. And then the second part of the holistic is to get to the root of the problem. Because if you have high blood pressure, it's not because you have a high blood pressure medicine deficiency. There are many things from lifestyle, diet, water consumption, so many different things that can play into it. Now, I still give people medicines like the guy that had the blood sugar of 560.
Oh, wow.
That said, well, doc, I just want to do natural. I said, no.
Sometimes you have to give some medication, right?
I said, you need drugs. So he ended up on 3 medications and insulin, 3 pills and insulin. And in 6 months, he lost 60 pounds.
Oh, wow.
And his blood sugar on nothing was normal.
Wow.
So I found you can really take motivated patients and make a huge, huge difference in their life. And sometimes it's very simple things. And I'm blessed with the ability to do a lot of blood testing. For my patients will say, oh, I'm taking plenty of omegas. It's like, well, let's see. Because it doesn't matter how much you're taking, it may not be enough. Or maybe you're not absorbing it. Or maybe you're not taking the right brand. So, my basic philosophy is if you give your body what it needs, it can heal itself. And if you listen to your patients, they'll tell you what's wrong with them.
Yes. Well, many of y'all know that I have been an RN for 20 years. And I can tell you throughout practice, we come across so many different types of professionals. And this is not a knock by any means on any other kind of physician. But what I think makes Dr. Dantin special is that she does really sit down and take the time with you to go through maybe the root causes of what's going on. Hey, Monique, look at my cousin from Florida. Really look at what the root causes of my symptoms might be, and I kept getting, personally, some of you know my story and some of you don't, but I, had a baby at 39. Things got really stressful with having teenagers and babies and running around at, trying to help take care of my mom who got sick, and then my dad who got sick, and then my grandparents, who are in their 90s. And things just got really stressful. So when that kind of stuff happens, I think your body starts giving you signals. And people would just tell me, oh, you're over 40 now. This is what happens when you're over 40. Or you can't live that lifestyle forever, you just have to accept it. Your waistline is gone after 40. And that was just something that I refused to accept. So I give Dr. Dantin a lot of credit for working with me and listening to me, where I know that I could have gone to another physician down the road that probably would have said, oh, you're fine, your blood work is normal, which it was, and you probably just need to take a little break. Well, I still didn't feel good. So I know a lot of you have told me, a lot of you have sent messages talking about how you don't feel good, and maybe you feel like you're run down, and maybe you have a lot of stress. So what is that underlying cause? And that's what Dr. Dantin is so valuable in helping you figure out. I mean, she spent an hour and a half with me going over I appreciate that so much, because even though I know, being a nurse, what a lot of those things mean, it still means so much to have somebody sit down with you and go down each individual result and say, okay, well, this is good, but it's a little on the low side, so maybe we can tweak this. Maybe you need this supplement. And, there could be a potential that you need this medication in the future, but right now we can try X, Y, and Z and come back and see how that works. So to me, that's just huge. You don't have to accept what your genealogy is. You don't have to accept that you're over 40 and you're just getting chubby, y'all. Or you're just starting to have aches and pains and it's all downhill from here, because it really doesn't have to be that way. So our retreat, Dr. Dantin is going to give us a really good discussion about gut health. That's her topic, and she's going to talk about how gut health, and I can even talk to y'all individually about how just improving my own gut health has helped me so much. And she's going to talk about specifically the gut microbiome, but then she's going to tell us how that relates to so many other areas in our lives that we don't even think about. How much your gut carries your immune system, how it affects your mood, how it affects your thyroid and your potential for autoimmune diseases. So she's going to just kind of tell us a few little tidbits right here, but we don't want to give it all away, because we want you ladies to come to the retreat, get the full benefit of really pressing that reset button and getting that amazing information and getting to meet Dr. Dantin in person, because I'm telling you, it's valuable. It's going to be amazing.
And getting to ask questions, because that's how I learn and that's how the audience learns. But it's interesting that what I call traditional Western medicine, or the standard medical care that you get, is actually starting to catch up on the fact that your guts are really important. I always tell everybody, your guts are like mama. If they ain't happy, nobody's happy. Because you think about it, I mean, if your intestinal system isn't working properly, there's some of the simplest things, like you can't digest and absorb your nutrients. And if you can't get that, well, then what are you running off of?
Right.
And most of your immune system is in your gut. Most of your feel-good hormones are in your gut. I know years ago, I always tell people, back when I was in medical school, they used to tell us, oh, those ladies with fibromyalgia, they're just crazy because you give them Prozac and they feel better. Well, Prozac keeps more of your serotonin, your feel-good hormone, in between the cells so they can work. And most of your serotonin in your body is in your gut. So the fibromyalgia, people that had chronic irritable bowel and all that started to get better, because in what we were doing with the antidepressant is we were fixing their gut.
Fixing the gut. That's amazing.
But so the gut affects not just your digestion and absorption of nutrients, it affects your brain with serotonin. And it basically, it takes care of everything. I remember when I first started getting into integrative medicine, the doctor there told me, he said, look, there's two things I'd suggest. You eat something alive at every meal. You have to have raw veggies and fruits. And he says, if I can only take care of one system, it'd be the intestinal system. If you fix that, you can take care of pretty much everything. It was so funny. I read an article the other day where there was this big revelation, because they did a study and they found, if you have bad gut health, you have more autoimmune conditions. And the functional medicine, integrative doctors have been saying that for decades.
Well, yeah, they've been saying it for 20 years. There was a book, y'all, written that the gut is called the second brain. If you Google it, find the second brain, and it talks about how much your gut health affects everything mentally. So if you have, maybe you have dementia in your family. I'm not saying that you can cure diseases or anything like that, but what I'm saying is that your gut health is so important in helping maintain your health throughout your lifespan that it's something that's often overlooked, and we definitely don't want to overlook that. I mean, we thought I had an autoimmune disease, and then those markers came back.
You can fix that.
Completely reversed.
To me, it's amazing how, for some people, really, with you, minimal lifestyle changes, sometimes just a few supplements, and working on gut health, because it always amazes me. You fix one thing, and that one thing fixes something else, and fixes something else, and you start feeling better. You have more energy. You can become more vested in your health, and you can do those things. Because, if you're too tired, you can't make the time to eat your fresh veggies.
Exactly. I talked about this on a video that I did a few days ago, where I just feel like a new person. I think you can probably pick up on, maybe if you go back and look at some of my videos from 6 or 8 months ago, and maybe I'm not as energetic as I am now. My energy level is so improved. My mood, I told my husband, I feel like myself, I just feel great.
The people around you are less cranky.
Yes, and I can actually remember things. I was having this issue where I just could not, brain fog. I could not remember, and I was like, oh my gosh, I'm getting dementia at 42 years old. What is wrong with me, But the supplementation has been exceptionally helpful. Your support has been just amazing. Pinky, the retreat is in Franklinton, and I will post a link at the bottom of this once the video is over, just to give a little bit of information, and you can scroll through my page and find it. But it's called the Fuel You Retreat. You can search for that in the top of Facebook and find it, and it's July 27th through the 29th, and Dr. Dantin is going to be speaking on that Saturday during the event. So we're going to be talking about all kinds of amazing things, so I can't wait for y'all to be there. And thanks for joining us. Did anybody have any quick questions that y'all want to ask really quick before we go? Hey Joelle, hey Stephanie, hey Brandy. Thank y'all for jumping on real quick. Alright guys, thank you Pinky. Alright guys, thanks so much for jumping on. I hope that if you're just catching this at the tail end, that you go back and watch the whole video and really see what we have to offer for the retreat. I know that Dr. Dantin is putting together a little goodie bag to go inside of our big goodie bag that I talked about earlier this week. So there's going to be all kinds of cool stuff, and I cannot wait to talk to you about it further. So thank you so much for doing a quick video. Alright guys, bye.
Have a great day.